Hello, everyone. I'm Jacob Wilkins. Welcome to this episode of Bearcat Chats. And we are highlighting on this episode the Decker College of Nursing and Health Sciences with Dr. Nicole Rouhana. She's the Director of Graduate Programs at the college. Sara Wozniak, who is the Senior Assistant Dean, and Isaiah Buchanan, who is a nurse at UHS right here in Binghamton. Thank you all for joining me. Nicole, let's start with you. You know, you focus on the graduate side, obviously, but just talk about the excitement that's surrounding the program and the new building in Johnson City.
Thanks, Jacob. Yes, we are very excited to be in our new home. We are closer to UHS. We're in a community that certainly can benefit from our care and our presence there. And it really provides us with a solid foundation to continue to expand our programs. So we currently offer a master's in the science of nursing in 4 different populations. That's family, adult, geri, psychiatric, and community health nurse practitioners. And we are experiencing some sustained growth there. And for us, that's a good sign. But it's also great for New York State because we continue to be one of the top employers in Central New York in healthcare. So we're excited to be able to have the room for growth and the student capacity to educate new students.
And how about for you, Sara? You see it from the undergraduate angle, but give us sort of your view of how things are going as a whole.
Everything is going very well. I feel like, we're reaching out to prospective students, both at the undergraduate and graduate levels. We've had open office hours for students to come and ask us questions. Our students have moved into the new building and they're making themselves right at home. There's actually some space for the student organizations. And so they sent me a couple pictures a couple weeks ago of them kind of decorating their spaces, which they've never had before. And so we're really looking forward to them making the building their own. Unfortunately, during this time, it's a little bit hard, but wandering around the building, which is right behind me, you will see students in study spaces, open spaces, and applications are up, which is great.
And we'll get to that in a moment. Isaiah, for you, as a recent alum, how satisfying is it to see this building come to fruition and all the potential it can bring for future students?
I think having this new space is absolutely amazing, especially for the students who are in their senior capstones that then have to go on to clinical right afterwards. It's a really short commute, which I'm envious of, to go to class right after having clinical. So it's really nice. And for what I've seen, the state-of-the-art simulation lab that was always great, but not a really large space, now has its own floor. So it's just amazing to see all the potential that there is for students to really engage with material and learn and gain their skills before they go out into their clinical settings.
And Nicole, Sara alluded to applications being up. To me, it really validates this investment in the building. I would think, is this something that's been expedited because of COVID and the pandemic, or were you starting to see this uptick before then?
We were starting to see that uptick, and I think we are fortunate that the Decker School of Nursing just celebrated our 50th anniversary. So we have a strong presence throughout the state, particularly in those rural areas, in the upstate area. So this has been an ongoing trend for us, particularly in the graduate program. And in view of COVID, we never for a moment thought that we should take a pause from educating nurses or take a year off or whatever. If anything, it really made us dig our heels in to see that now is more important than ever to open up those seats for spots in nursing programs, both at the undergraduate and graduate level. It was interesting that last year in January of 2020, the World Health Organization declared 2020 the year of the nurse and the midwife. And when that happened in 2020, we didn't really think anything about it, but less than 60 days later, nursing was sort of thrust into the limelight of caring for vulnerable populations, being with people when they take their last breath, having to serve so many people during a pandemic. So yeah, I think the timing was perfect, and it just solidifies our reasons for doing what we do at Decker.
And Sara, I don't know if, I imagine admissions, they look at those specific applications and read the stories, but I'm sure you're hearing from students who are interested in the college, and there must be a lot of personal connection to this profession because everyone's been affected, by the pandemic.
Right. And even before that, I mean, my previous life was in undergraduate admissions on campus. And so I've always found that our students somehow have a connection to healthcare, whether it was themselves or through a family member or a loved one or volunteering. I'm sure Isaiah probably has his own story. But it's so interesting how passionate they are, and sometimes how early they decide that nursing is exactly what they want. And I really love working with this population. I never thought I would be working in a College of Nursing and Health Sciences because I am not a nurse, but I absolutely love to help students identify their pathway and their goals and help them achieve those.
Absolutely. Everyone has a connection because healthcare is a calling. You can't go into it thinking about finances or the potential of having prestigious title or even being the number one trusted occupation that's out there. But you genuinely have to have a reason that you want to engage with people and use your background and your experiences to help them during some of their toughest moments. So for me, my background is a mix of hospice, working in an emergency department, as well as growing up with a nurse. My grandmother was a nurse. She raised me pretty much. And when she died, I kind of didn't want to do anything with healthcare at all. But then gradually, that call was still out there like a siren, just pulling me in. And I got back to healthcare, and I couldn't be happier with my decision or where I am right now. So I'm really thankful that I took time to smell the roses, see if this was really what I wanted to do, and then just listen to my heart and actually do what it is that I love doing.
Wow. And Nicole, where do things go from here? I know there's a lot of work on developmental programs like speech pathology. What are the years to come looking like?
Well, we will continue to expand on our 4 programs that we currently offer. The other thing that's happening on a national level is entry level into advanced practice. So to become a nurse practitioner or a clinical nurse specialist, those students will have to be trained at the doctoral level. So like we have the PhD program at Decker, which really supports a research intensive career, we will be offering the Doctor of Nursing practice for our nurse practitioner form of education in the year 2025. So this is a national regulatory change that's happening, and it really will bring nursing to the table with our other clinical doctorates. The other initiative that's really strong is on campus. We have an interprofessional education component. So the nurse practitioner students in pharmacy, social work, and Masters of Public Health have 2 courses, and we learn with, from, and about each other. And it's fascinating to watch these groups of students come together as new professions and start to learn about what you do and how do you say this and what does that mean for your profession. So we're hoping that we give them that extra edge when they graduate. They'll already know what it's like to work with PT and OT, and what are the ramifications of public health if I'm a nurse practitioner? How can my pharmacist help me deliver safe care? So that's something that we're also really excited about in our new building.
And here's a question really for both Isaiah and Sara. Sara, start with you. To a prospective student that is looking whether for 2022 or the fall, making a final decision with the new building, which looks great behind you. What are the things that they can not just look forward to, but really expect out of an education at Decker?
I mean, the technology on the second floor is just absolutely unbelievable. People who have been in the building thus far have said, if I do land in a hospital bed, I wish it was here. This is absolutely beautiful. I mean, the space, the people, the other students that are choosing our program, the community, everything about it just makes sense. And, like Isaiah and all of the alumni that are, part of Binghamton University, stand behind the education that they received. And it's amazing that recruiters at some amazing institutions really seek our students out after graduation, sometimes even before they graduate. And so it's just really refreshing. We're about to have a job and internship fair this semester, and a lot of employers have secured their spot to meet with our students and present in small groups or meet with them one-on-one, because they're very interested, because they know the education that the students are graduating with.
So I just have to say the education that you receive as a Decker student, second to none. Employers know who we are when we come in there and are able to navigate the process of working with patients, talking to doctors, just a very holistic approach to patient care. And we know how to dot our I's and cross our T's. The program definitely ensures that. So it makes for a really nice transition. And I think employers know that coming in. So they are definitely energized and excited to have our students. Also in simulation, there are times where they record you as you're doing different procedures. And I will say that when you go into a patient room and you have to do something, they're watching you, their families are watching you, other people are watching you. So having that moment of, okay, I know I'm being recorded, I know how this works, I know how to do everything correctly, it makes for a really nice moment, because therefore you're able to do what it is that you need to do and still engage with your patient, because you're not like, oh my goodness, how do I do this? How do I do that? You know how to do it. You've been trained well. They've taught you well. I can't say anything bad about the program.
It's amazing because students, you can tell as they approach graduation, the end of their program, they get so nervous and they feel so unprepared and not ready. Like, don't push me out the door. I'm not ready. I have no idea what I'm doing. And then it's so amazing to see them on the other side, and they've really just matured and grown into their role, and they feel more confident. Not 100% confident, which I don't know that any of them ever do, which is a good thing. You care, you're always learning, and you're always wanting to learn new things and be in those uncomfortable situations, because they push you to learn and grow. But it's just amazing that, we always tell them, you are ready, you're ready, and you will be fine. And it doesn't matter how many times we tell them, it's year after year. They're always nervous around the same time. They're worried about, preparing for the NCLEX or, any licensure exam and preparing. And it's just funny to see them several months out after they've passed, they've gotten a job, they've gone through orientation, and they're really starting to get into a groove. And that's really when I get excited to see them on the other side, to say, we told you, we told you you would be ready, you would learn what you needed to learn, and you would be great. And they are great. They're amazing, and they make us very proud.
Well, there's such a great climate of collaboration and all the, excitement moving forward, and really appreciate Nicole Rouhana, Sara Wozniak, and Isaiah Buchanan, your time and continued service to make the Decker College so successful.
Thank you, Jacob. We really appreciate your time.
Thank you.
Thank you very much.